Hi, I'm Tori Johnson, and today I will be discontinuing and removing my patient's peripheral IV. So before we start this, I'm going to make sure that I have the correct order from the patient order to have the IV removed. I'm using the fake skin today, but we are going to say that this is the patient's left arm and this is in the antecubital area for their IV. Okay, so I'm going to get started. Upon approaching patient room, I will do hand hygiene. I'm going to identify my patient with the two factors, name and date of birth, and check their wristband if they have one by the policy of the facility. Okay, so I did hand hygiene. I'm going to put my gloves on. I'm also going to be following all GPSP guidelines through this entire skill and any policies that may be in place per the facility. So I can get my gloves on. Okay, so I am going to start out today after identifying my patient by inspecting and assessing their IV port. Let's see, so they have no redness, no swelling, no abnormal drainage, and they have no verbalization of telling me of any extra pain or anything that's bothering them. Skin looks good, IV looks good. Okay, so we're gonna make sure that we turn that drip off if it is still on. Okay, I got my gloves on, I got my supplies ready, and so let's get started. This fake skin is very hard to work with, so please give some grace. Okay, so I am holding the IV to make sure that it is stable while I pull back from the sides to ensure no skin irritation from my patient. Okay. And I'm gonna pull that from one side to the other while still stabilizing that IV. I will go in with gauze and in one fluid motion pull that IV and hold. That's the cannula. Hold the pressure. I will inspect the cannula to make sure this is just an IV at home, that it did pull everything out and there's nothing left in their injection site. So I will take this and dispose of that in my sharps container. Okay, so we will apply pressure to this, observing while we're doing that for any irritation on the skin or any reaction from that. So I will remove that gauze. Okay, throw that away. All right, looks good, skin looks good. Apply pressure with a new clean gauze and bandage that with tape. Okay, so this is where I would reassess with my patient, make sure they are not in pain, make sure they are feeling okay, and answer any questions that they have. I would also ensure that they get their education to kind of not bother or irritate their IV site. So I will remove my gloves, throw those away, do my hand hygiene, answer all patient questions, ensure they're comfortable, always leave the call light within reach, and record